Guys, Dr. Connor LaVallie here at 240 West River Drive, St. Charles, Illinois, with Greater Good Chiropractic Care. Right now, we're sitting down with Ashley Anderson. She's a registered dietitian and certified personal trainer. She got her bachelor's degree from University of Illinois in food science and human nutrition, graduated with honors, and also got her master's degree from University of Northern Illinois. So we're going to talk a little bit about what you guys can do to best take care of your own health and some of the steps you can make towards bolstering your immune system as well. So Ashley, welcome. Great to be with
Thank you so much for the introduction. Really appreciate it. And thanks for having me here. You know, one of the biggest questions that I've been getting recently is, what can I do for my immune system? Everybody is so worried right now with their immune system, their health, their stress levels, and everything that they've been impacted with as far as COVID-19 goes. And, you know, what can they do on a daily basis? So
your health is really your number one asset. It's like what we like to say a lot of times when it comes to having conversations within the practice. Because without your health, you have nothing. Sometimes use the job of Steve Jobs, right? Using him as an example, because he had billions of dollars, but he still did not have enough resources in order to take back his health once he had that terrible diagnosis. So if we can take the proper steps towards making sure that we're adapting and creating the best possible environment for ourselves and our loved ones, that's going to be the best possible outcome.
Totally. Wouldn't agree more.
So the first thing, what would you say?
So first thing is moving your body. Moving your body every day. And everybody goes, you know, how much should I be moving? And the recommendations are 150 minutes weekly, but really I think moving your body at least 30 minutes every day.
Yeah.
And I know you move your body quite a bit.
Sure do.
You're an avid exerciser. So what can you do right now during COVID-19 when all the gyms are closed and you can't quite get to the places that you normally go to and as part of your typical routines? You can do bodyweight exercises. You can do a workout from home. You can run up and down stairs. You can go to a local park as long as you're not roped off. And, hang around on the monkey bars a little bit and just do some of those movements that really just get your body moving, get your blood flowing. Your overall immune system is dependent upon it. The way your body detoxifies itself is dependent upon movement. So really getting your blood flowing is really crucial to the community.
Yeah, huge point, Ashley, too. And one of the main things you also get from just by spending that 30 minutes a day is increasing your insulin sensitivity, which is one of the main aspects that creates sort of a chronic disease within the body. So when you're not creating that adaptation by challenging your body, the foods that you eat, first and foremost, will create sort of a high blood sugar situation, and your body's not able to take that blood sugar down with the insulin production from the pancreas.
Totally.
And that's all starts with moving your body in a most focused way. But again, it's the minimal effective dose. You don't need to recreate the wheel. We're just talking about tiny little shifts in the right direction.
And what you're talking about too is like even after a meal, going for a walk, with your loved ones after dinner can have tremendous benefits on having your body utilize insulin appropriately, especially if you're someone who has diabetes. Someone who is a compromised system that right now is taking a little bit more time or is a little bit more challenging to be able to utilize what it needs to kind of fit those nutrients into the cells.
Yeah.
So if you're not as familiar with insulin, using insulin as a way to get nutrients, to get what we call our carbohydrates or our glucose across cell walls, and assistance with movement can only help lower your blood sugar. So it's going to help your body work more efficiently and be able to use the sugars more effectively.
Spot on. Yeah. And back in my, natural bodybuilding days, what I'd get most questions about are supplements, right? Everybody wants to know what the quick fix is. What supplement can I take? And I'd always get just a tiny little bit, nixed by that, because really what you should be asking is, what should I be eating? How should I be moving my body? Because those are more fundamental than a quick fix that you get from a potential supplement. You've heard of brain-derived neurotrophic factor, right?
Of course. We talked about it.
That's right. Hugely beneficial protein that's produced when you get that minimum 30 minutes a day of exercise. Brain-derived neurotrophic factor not only increases your resilience to viruses and bacteria, but also will increase your memory capacity, your learning capabilities, and just your overall vitality as well, which is hugely important because that's going to govern not just how you function, but how you're feeling on a regular basis, which feeds into each other. So BDNF, huge benefit of getting that 30 minutes a day.